Hi friends, welcome to classes by Lab Doctor. In today's class, let us see what are the causes for low calcium level in our body or hypocalcemia. So we all know that the total calcium level in the serum is around 8.5 to 10.5 milligram per deciliter. When the level of calcium goes below this normal range, it is called as hypocalcemia. Cause of hypocalcemia can be because of inadequate intake or impaired absorption, or there is increased excretion, or there is an associated mineral deficiency like magnesium deficiency, acute pancreatitis, etc. So let us see which are the few causes of hypocalcemia. So, when I say decreased calcium absorption, we all know that calcium is absorbed in the small intestine. 80 to 90% of calcium is absorbed in the small intestine, and around 3 to 6% is absorbed in the large intestine. And we know that for the absorption of calcium, we require vitamin D. When there is vitamin D deficiency, it could be because of decreased intake. Suppose if the patient is malnourished, there is no adequate consumption of calcium, vitamin D, then the patient can have hypocalcemia. There is decreased intestinal absorption. Suppose there has been a intestinal bypass or there has been a gastrectomy, so the calcium will not be absorbed itself, so then there can be hypocalcemia. Suppose there is some problem with the liver, there is liver failure, then the vitamin D which is produced in the liver will not be available, so that can lead to hypocalcemia. Suppose if there is renal failure, the kidney has failed because of a chronic kidney disease, etc., then there will be less of vitamin D, so that can cause less of calcium. So these all can lead to decreased calcium levels in the serum. If there is malabsorption, there is difficulty in absorption of calcium itself, so that can cause a less calcium level in the serum. So first would be decreased absorption of the calcium. It could be because of decreased intake or decreased absorption. So next cause of hypocalcemia is alcoholism. So alcoholism, what it does, it impairs the calcium absorption. So what it will do, it will make the body difficult to absorb calcium, vitamin D, which are very important for bone health. So because of this, the bone density, you can see that the density of bone decreases and the risk of fractures will increase. It also causes issues with the remodeling of the bones, alcohol, and also causes hormonal changes that affects the bone health, such as estrogen. So this alcohol can affect estrogen levels, and estrogen is very important for maintaining the bone health, bone density. So that is why bones can get weakened if you are consuming a lot of alcohol. It also affects the bone turnover, the bone formation, etc. So increased consumption of alcohol can lead to decreased calcium level in the serum. Next would be the defects in parathyroid gland. You all know that parathormone is an important hormone which regulates the calcium level in our serum. So what does the parathormone do? Whenever the serum calcium level is low, the parathormone will be activated. So what it does, it will help the osteoclast, it will activate the osteoclast, and they will resorb more and more of calcium, and they will increase the level of calcium in the blood. They will stimulate the kidney to absorb more and more calcium. They will stimulate the intestine to absorb more and more of calcium. So it will increase the calcium level in the serum. So whenever there is a defect in parathormone secretion, then the calcium level can be less. suppose if there is a thyroid surgery, so you know that the parathyroid glands are in close association with the thyroid. So if there is a thyroid surgery, if there is a parathyroid surgery, or if suppose there is an autoimmune destruction of the thyroid or parathyroid, or there is some cancer which is infiltrating the thyroid or parathyroid, there is some familial syndromes, this can all destroy the parathyroid. And whenever there is parathyroid hormone deficiency, the calcium level in the blood will be low. So remember, if the PTH is low, calcium is going to be low. So any condition that can affect the PTH, the surgery, the autoimmune, or the infiltrative, or certain syndromes, can all decrease calcium level in the blood. So there is something called as the hungry bone syndrome. So what happens in this hungry bone syndrome? Severe and prolonged calcemia, hypocalcemia, often which develops in the setting of post parathyroidectomy for a high PTH level. So whenever there is a high PTH level, parathyroidectomy is done, and once this parathyroid is removed, there will be severe and prolonged hypocalcemia which develops. That condition is called as this hungry bone syndrome. So this high PTH level, what it will do, it will drive the net efflux of the calcium from the bone. So abrupt withdrawal of this PTH, what it will do, it results in marked uptake of calcium, phosphate and magnesium. So because of which what happens now, suddenly the PTH is not there. So there is hypocalcemia, hypomagnesemia, hypophosphatemia. So these bones are now hungry. This condition is called as hungry bone syndrome. So it is a syndrome which happens after the post parathyroidectomy for a high PTH level. When we do the post parathyroidectomy, this level of hypocalcemia develops, which is severe and which is prolonged. So that is called as a hungry bone syndrome. Now there is something called as pseudo hyperparathyroidism. Pseudo hypoparathyroidism is a genetic disorder. It's a very rare genetic disorder wherein the body is resistant to parathyroid hormone. So the parathyroid hormone, though the levels are normal, the body is resistant to that PTH. Hence, when it is resistant, it cannot perform its normal function, and the calcium level in the blood is going to be low. So this results in low blood calcium and high phosphate levels in the serum. Magnesium can also affect calcium homeostasis. Both hyper as well as hypomagnesemia can cause hypocalcemia. So when the level of magnesium is high in the blood, that can also cause hypocalcemia, and when the level of magnesium is low in the blood, that can also cause hypocalcemia. So both high and low magnesium, basically magnesium levels, can affect the calcium homeostasis. So when the phosphate levels are high, they can lead to hypocalcemia. So this hyperphosphatemia, what it will do, it will bind with the calcium, causing the low calcium levels in the serum. So this, suppose in case there is a kidney failure, or there is a critical illness, or there is an excess tissue breakdown, etc., the higher level of phosphates can combine with this calcium and can lead to low calcium level. In chronic kidney disease, when there is an impaired phosphate excretion, this will lead to secondary hyperparathyroidism, and this can also cause low serum calcium. Impaired phosphate excretion occurs, and this can cause hypocalcemia. So hypocalcemia can also occur because of certain medications like furosemide. They will increase the excretion of calcium from the urine. Insulin, corticosteroids, certain laxatives, certain antibiotics like degraded tetracyclines, etc., they can cause hypocalcemia. This hypocalcemia depends on various factors. It could be the intake of calcium, it could be the absorption of the calcium, it could be the excretion of the calcium. So whenever in this loop, whenever there is a deficiency in any one of those, it can lead to hypocalcemia, maybe decreased intake or decreased absorption, increased excretion, or the deficiency. There is any change in the calcium regulating hormones, may it be PTH, may it be calcitonin, may it be vitamin D. They can all affect the calcium homeostasis. These are the common causes of hypocalcemia. One is decreased intake of calcium, hypoparathyroidism, vitamin D deficiency, or there is an insufficiency, diseases that affect kidney and liver because they are the main organs for the functioning of vitamin D, pseudo-hypoparathyroidism where the parathyroid is there but the tissue is resistant to it, hypomagnesemia or hypermagnesemia, both can cause hypocalcemia. Hyperphosphatemia, increased phosphate will combine with the calcium and that can lead to decreased calcium. Hungry bone syndrome, parathyroid is removed because of excessive PTH and now low PTH has happened and now the calcium level has reduced very much. So that is hungry bone syndrome. Rapid citrated blood transfusion that can remove the calcium. Certain medications like laxatives, diuretics, degraded tetracyclines, etc. These can cause decreased calcium level in the blood. So the clinical features of this hypocalcemia will depend whether it is an acute hypocalcemia like which occurs in critically ill patients when they have been given drugs like citrates, etc., or it is transient hypocalcemia. There has been an acute renal failure, there has been a transfusion, there has been a sepsis, there has been a drug given, which could be transient hypocalcemia, or whether it is a chronic hypocalcemia. So the symptoms will depend whether it is acute, transient, or chronic hypocalcemia. So hypocalcemia is a condition when there is actual level of calcium is low, below the normal range. There is something called as factitious hypocalcemia. This is a condition wherein there is decrease in the total calcium level but the ionized calcium level is normal. So I have told you that whenever we talk about the serum calcium, that is the total calcium. It includes both. It includes the calcium which is bound to the proteins and also the free calcium. So in factitious hypocalcemia, the total calcium level in the body will reduce, but the ionized calcium will be normal. So in factitious hypocalcemia, the ionized fraction of serum calcium is normal and it is because of the reduction of the serum albumin the patient will have low calcium, because when the binding to calcium agent albumin is less, the calcium also appears less. The patient will not have any symptoms or signs of hypocalcemia in this factitious hypocalcemia. So if the level of serum albumin falls below 4 gram per deciliter, the usual correction is to add 0.8 milligram per deciliter to the measured total serum calcium for every 1 gram per deciliter reduction of serum albumin. So we will have to make a correction. For every 1 gram per deciliter reduction of serum albumin, we will have to add 0.8 milligram per deciliter of calcium. Whenever the serum calcium is low, we will have to order the ionized calcium to see whether it is an actual calcium deficiency or it is just a factitious hypocalcemia because of decreased albumin. So when you know that actually the calcium is low, it is confirmed hypocalcemia, then we will have to find out what are the causes. So we will see the PTH, whether the PTH is low or the PTH is high. If the PTH is low, it can be hypoparathyroidism, most commonly post-surgical hypoparathyroidism. Suppose a patient is having low calcium, high PTH and the magnesium is also low. It could be a malabsorption syndrome or it could be an alcoholism. Patient is having high PTH, patient is having low calcium and the phosphate levels are high. So it could be pseudo hypoparathyroidism. Hence we will have to work up the case of hypocalcemia. hypocalcemia, correlating with the proteins, correlating with the parathyroid hormones, parathormone, correlating with the phosphate levels, magnesium levels, creatinine levels, calcitrol levels. We will come to a conclusion as to what could be the cause of hypocalcemia. So that is all about causes of low serum calcium. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.